medical professional based in New Delhi. I'm a senior consultant pediatrician and nephrologist and a healthcare administrator, being in healthcare for the last 35 odd years, and in real hand been experiencing the ongoing crisis which not only India is facing but the entire globe is facing. So initially, just to set the parameters of this short talk on COVID-19, uh, this is a pandemic which was declared by WHO a few weeks back, and the word pandemic actually means that above the normal incidence of disease incidence that uh, that classifies as an epidemic, and across globes, across boundaries, where most countries are involved and seeing lots of mortalities and morbidities. Uh, this is a virus which is an RNA virus, which is a zoonotic virus, which has come from animals, mainly the exotic species of bats and snakes, which, because of abnormal eating habits in the eastern part of Asia, came into human beings. So the virus mutates. And when it comes into human beings, it's a new virus. So the human beings don't have any antibody proteins to fight this virus. So the body cannot host any response to fight this virus off, and therefore we are seeing this high rate of incidence of infection and indeed the unfortunate rates of death. As far as the spread is concerned, it spread from east of Asia into Korea, then Japan and other places, and now it's in more than 210 countries. The incidence is almost reaching 2 million population as those infected, and almost reaching a rate of more than 25,000 fatalities in US, and equal amount in Italy. Spain is badly involved, France is badly involved. In India, we've seen about 370 odd deaths. Uh, this is truly what we call as putting the entire globe in a deep freeze in suspended animation. It's like putting the entire world on a reset button. Uh, in such times of crisis, you actually realize what's the value of a human life, and what's the value of a human life saved. This is a bizarre arrow which has pierced through the heart of the entire medical fraternity worldwide. And in these kind of situations, the entire globe has to take tough decisions, not only in one country but in most countries across the globe. Uh, as far as the Indian dynamics is concerned, we know that our public health system still has to be evolved a great deal. We have approximately 10 to 11 lakh doctors in India, and we need the equal amount more. So we are in deficit as far as medical manpower is concerned. We have approximately zero point 0.7 beds per thousand population and zero point 0.8 doctors per thousand population. And if you compare this with most countries of the Western world, they have approximately 2.5 to 3 beds per thousand population. That's 4 to 5 times more, and 3 to 4 doctors per thousand population. That's 5 to 6 times more than what India has. So the deficit really is startling. Apart from that, India has a population of almost 137 crores. And if you compare that with the US or in Italy, to give you a comparison, India has 2% of the total global landmass, 18%, 18%, I repeat, of the total globe's population, and 21% of the disease burden globally. So one in every 5 deaths which happen actually worldwide happens in the Indian subcontinent. When you look at these kind of figures, America has a patient population density of 36 per square kilometer, and India has 480 people per square kilometer. So India is a very densely populated country because of the population, and therefore the spread which happens in this virus, going from human being to human being as transmission through cough droplets or sneezing or through personal contact, can become very rampant. This COVID virus, in terms of the structure, is a little bit slippery customer, and it's a very invasive virus. Therefore, we must learn to respect the virus. It has a covering, and it has 4 proteins, and it has 2 subtypes as serotypes. and it has mutated. So therefore, the treatment protocols are still evolving, and the vaccine is still underway, but it is at least 12 to 18 months away. With regards to the treatment of this COVID virus, what we call as COVID-19 as a pandemic, there is a lot of debate and a lot of talk and a lot of discussions happening, not only in the medical circles, but the social circles and the political circles. At the present moment, to put facts on the table, there is no approved, justified, uh, as a double-blind, controlled, randomized, multicentric trial, which is peer-reviewed, to actually document that a particular line of therapy works. So the only therapy or any therapeutic intervention is what we call as a complete lockdown and social distancing, which I shall just explain very briefly in the next few minutes. So when you look at a transmission, it can happen through cough, through sneezing, through small droplets, which can remain suspended in the air for a while, come onto surfaces like doorknobs or tabletops and other places. So we have to be extremely careful. The real basis of having a global lockdown in every country is that you have human intervention in place, which actually stops human being to human being transmission from one person to another person. So when you look at a lockdown and social distancing, that means you keep a distance of at least 3 to 4 feet, preferably 5 feet, from one person to another person, and wearing a mask which covers your nose and mouth. The real basis of this is what is famously called these days is flattening the curve. What really does it mean by calling flattening the curve? When you say flattening the curve, that means the total incidence which is there of number of cases versus the time. So it's on X and Y axis. So if you have a longer duration of time and spread the number of cases over a longer duration of time, so the curve in terms of the spike gets widened and flattened. This gives us more time to have adequate infrastructure ready, because no one in the world was ready for this kind of a sudden pandemic. And the number of beds, the number of personal protective gear can be more geared up in each country to look after it. What really has happened worldwide in the medical community is that this has been a ravishing carnage which has happened. It's completely catastrophic. Italy healthcare system has been stretched and destroyed. France is struggling. Spain has been devastated. New York being the next epicenter for this huge surge of cases. And a lot of my colleagues who are working over there really don't know what has hit them. They've never seen this kind of number of cases which they are experiencing at the present moment. And we are at a very critical time as a part of our evolution of this pandemic within the Indian subcontinent. We are about 3 weeks into the lockdown, and Honorable Prime Minister has extended it till first week of May, which is extremely justified because it gives us more time to quarantine, to isolate, to test, to identify the contacts, to do the contact tracing. And in terms of testing, there are basically two types of tests which are being done. One is what we call as the PCR test, real-time PCR test, that catches the antigen in a human being. And the second test is what it is called as, it's an ELISA based test. It's a rapid test. It's a quicker test. It's a cheaper test. It isolates the two forms of the antibodies proteins in the human being as a response to the infection, what we call as the IgG and IgM. So it gives you a past history of infection, it gives you an indication of those infected, and it gives you a kind of in-depth analysis of those who are recovering. So the total number of cases to capture becomes more accurate if you include the PCR real-time test and the ELISA IgG IgM test. In terms of the various studies which have been conducted worldwide, and there are a huge amount of papers being published from every part of the globe, including all the countries in the European Union and in the greater part of America, in New England Journal of Medicine, in Lancet, in infectious disease journals worldwide. Still to date, we don't have a documented protocol. So the huge concept of hydroxychloroquine and other medications being used are still not FDA approved, and they should not be stored at home. There should be no hoarding of this medication. There should be no self-medication, no irrational use of any painkillers or fever medicine, because that can cause more harm than good. and there is no rational medical use of any antibiotic. So in terms of the warning signs, in case you have any high grade fever, if you have a cough which is typically dry and hacking, and sudden onset breathlessness, especially if you have comorbid features such as hypertension, cardiac diseases, asthma, COPD, or any other chronic liver or kidney disease, immunocompromised state, or if you are on steroids for any reason, please consult your local doctor, get yourself checked rather than self-medicate. Do not hide this symptom, do not hide the infection, because you are potentially going to transmit it to other people in your family and then your neighborhood and in your community. So a pandemic really goes through various phases in a society psychologically. First is the stage of denial, in which people tend to have a disbelief. They feel that it can't happen to us, it's happening somewhere else, I'm safe. The second is a stage of in which is an initial stage of realization, in which there is anger, there is frustration. You start asking questions of yourself, you start asking questions of the government, you start asking questions of the society. And last is a stage, and if you reach the stage last and it's delayed, is a stage of devastation and disruption and destruction. So we have to be very, very careful in this. And I keep repeating that this lockdown has actually slowed down the progress in India. The appropriate lockdown in India has been extremely beneficial. You have seen in real-time data which the government is displaying through various portals and social media sites and through the digital media, that we've had a very, very low case fatality rate as compared to most Western countries, even with our limited sources. So we are actually perched at a very defining moment in our history. And I think it's important that this invasive and a very high impact pathogen, which has scavenged and ravished most parts of the world, uh, doesn't go, our nation's sacrifice doesn't go in vain. I think the entire momentum is the society's momentum now. The government has given instructions. It is us to follow it so that we save our lives, we save our families' lives, and we save every human being who we come in contact with in our society. Uh, so we have to be very, very agile. We have to be swift in our decision making, which the government has been. And I keep saying this, we have to aviate. That means we have to fly with the situation, because the situation is dynamic, it is changing, it is evolving. We have to navigate through roadblocks. We will sometimes come across hot pockets. That means hot zones where the incidence is high, and there are super spreaders. Super spreaders means those who infect more number of people in the community. And of course, then communicate. We have to have a very continuous mode of communication between the government agencies, between the local law enforcement agencies, and the community at large. Now, when you look at going through this huge tempest which has hit us, we must have resilience, we must have faith, we must have patience. And our Prime Minister has mentioned all these things in terms of having the various facets in our society of having honor for the society, having respect for the society, and having faith in the society that we can all stick together and fight as a united team India. Uh, in terms of this of what is going to be happening now, I think the world will go through various phases uh, in the immediate aftermath of this and the long term aftermath of this. And while we clean up the consequences and the sequelae of this catastrophic pandemic, we will overcome, and through various phases of life, we will overcome long periods of isolation. Very often, people will have loss and grief of the loved ones. We have to face the factor of unemployment, the migrant labor, the poorer section of a society, which we have to be compassionate and sympathetic to. We have to look at the financial insecurity and the financial economic impact. And when I mention the financial impact, this has a very small relevance in comparison to a cost and value of a human life, which is supreme. The stress of acceptance of the new norm. And I shall describe that what the concept of the new norm is going to be in the post corona era. Uh, it's an entire focus of COVID, keeping in mind that we are also living in a tropical country, and in the monsoon season, which is coming in the next 2 or 3 months after the scorching heat, we are going to have the routine illnesses in India of the upsurge of malaria and dengue and the ongoing diseases of tuberculosis and pneumonias in our society. And while most of the large countries, including ours, the top scientists and researchers are scrambling to find a wonder pill, hopefully we should have an internationally recognized and accepted protocol and the vaccine at least by end of this year or early part of next year. Uh, there is also a lot of concept discussion with regards the immunity basis amongst Indians. There is a discussion on the role of those countries which are endemic zone of malaria. Do we have any immunity with regards to that? Is there an innate role of immunity base which is built up because most Indians have been vaccinated with BCG? There is a discussion with regards innate Indian immunity because of uh, a different flora in the gastrointestinal tract, or indeed the ambience temperature when the temperatures are hitting 35 to 40 degrees plus very soon in most parts of the country. Most of these concepts are under investigations through top researchers, and hopefully the Indian population would have, I hope and pray that some sort of innate immunity which has been built up because of the BCG vaccine, although it is still to be comprehensively proved. Uh, there is a lot of discussion whether the lockdown implementation was correct. The answer is yes, it was correct. Was the timing correct? The answer is it was most appropriate as far as the timing is concerned. It's a huge job. It's a humongous mammoth task to coordinate various agencies of the government and the society for 138 crores plus people trying to cooperate as one movement. It's the largest society movement ever seen in the world. It's much more than a census, it's much more than an election protocol because you're dealing with human lives. Uh, and very often I say that cometh the hour, cometh the man. And I think with the leadership of what the government and our Honorable Prime Minister has shown, hopefully we will have lesser damage than most other Western and advanced countries. Uh, we must pay a lot of attention to the mental and the psychological state of a huge mass of patients who are coming after the infection or their relatives or a society at large. And very often the disease itself uh, will not do so much harm as much as the psychological impact which it does into the person's psyches. And very often they carry the emotional burden and the psychological burden for many years after that. So to understand the psychological and the mental state of a community at large is extremely important, not only through doctors, but through the community, through support groups, through the government. And we may actually have a lot of people who will be so-called ruminating biotypes who are dwelling into the past and carrying the psychological impact and the carcasses of the past experiences, the negative thoughts. I think we all together have to unite to fight this through and help each person through as citizens who are responsible and committed to our nation. I think we are now at a stage in which we will soon be embarking to bridge between the old world and the new world. I think a lot is going to change. Yesterday's normal is not going to be tomorrow's norm. I think the way the entire globe has approached life, much of it will change. We have to understand that social distancing is something which we have to live with for many, many years, and it is for our betterment. We have to realize that personal hygiene is extremely important. We have to understand that spitting in public areas is extremely dangerous. It can spread not only COVID-19, but a host of other infections, including tuberculosis. So while we bridge this gap between the old world and the new world and bid portals and bridges and enter into an era which hopefully for all of us as Indians and the globe will be a better place, leaving the past prejudices behind, leaving the old data behind, leaving the dead ideas behind, leaving the smoky skies behind. I think a lot of cleaning up will have to be done post COVID era. Uh, the lockdown exit also has to be in a very gradual, graded, phased manner. It has to be calibrated according to the situation of that week, of that day, of that hour. And we cannot fear what the unknown is ahead of us. We have to take it on head on. And the main drivers to take this decision of this graded exit plan will be data and not random assumptions. It will be government supply chains and logistics supports. It is going to be the medical preparedness in terms of the beds which we require, the ICUs we require, the oxygen supplies, the personal protective gear which is required, the ventilator supports which are required, the routine medication which is required, the psychological support through the medical team which is required. We also have to learn to understand that the doctors, the medical staff and the nurses, a lot of them are infected. Almost 15 to 17% of the global deaths worldwide are the medical people, are the doctors, are the nurses, are the back office staff in the hospitals, because they are the front runners. They are the first people who come in contact with patients potentially infected with COVID-19. So it's a huge amount of task on them. I think we have to show a lot of sympathy, respect, and love and compassion for the medical team, which have worked tirelessly for many, many months now on this. And this is not only in India, but worldwide. The exit plan will also depend upon the value and the mass of testing, both the PCR test and the ELISA test, which is the IgG, IgM test, so that we get adequate amount of data, which can actually tell us uh, exact description of the hot pockets and the distribution of cases using good amount of digital technology. I think it's the complete role of the society. I think the society cooperation, the Indian population cooperation is going to decide how the graded exit plan is going to pan out. And last and most importantly, of course, is the economic rejuvenation. So the world organizations, including uh, various global top leaders, have declared that, including IMF, that the world is going to be in recession and the economies are going to be in a very slow speed. I think it's important to understand that the economies of the world are not only in recession, but they will be in a paralyzed state for a while. So recession is when you have a buyer and a seller. At the present moment, both are not there. So it's going to take a while before it kicks up. But I think this is a great, huge golden opportunity for the country like India, which can actually convert this adversity into an opportunity. And believe you me, I think this is going to be a huge turnaround moment as far as India is concerned, to actually catapult its growth and position and name and fame as a global superpower. I think the entire industries of the world, not only from Asia, in terms of manufacturing, in terms of service, in terms of BPOs, in terms of back office staff, uh, including the technology, the IT is going to shift out of certain parts of Asia into India. And I think here lies the opportunity. There is a hardship. I think there is a huge amount of sacrifice, which not only the government has done, but every citizen has contributed towards this. But I think on one hand, when you look at sacrifice, it's for a long-term gain. And I think we can only look at economy if we come through this aftermath and this storm. We have to be alive to eat. So I think the first thing is to save human lives. And what the Prime Minister has done is he's put nation first, human life first. Everything else can follow. And I'm a firm believer that I think the Indian economy will kickstart. It is going to take few months, but it is going to go on upstream. We cannot go downstream with negative thoughts and rolling down into oblivion. I think we have to be strong enough to face what we have to do. And I think the maturity and the intellect of the Indian population is going to shine through. Uh, it's also important to realize that the world at large has invested far too much in weapons, in rockets, in missiles, in nuclear arms, and what consequences it to at the present moment. I think the world has been brought down to its knees. It's been overwhelmed. It's been simply shattered into pieces. And suddenly you realize that this huge amount of arms which every Western power boasts of did and can do nothing to save human lives in moments of crisis. I think this is a wake-up call for not only India, but the entire world. Let's invest in public health. Let's invest in population control. Let's invest in vaccination and preventable diseases. Let's invest in health education. which can teach people the correct way and the correct life of living, in nutrition. These are all things which actually build up a nation's character. And I think it's important. This is a defining moment for us. It's time to wake up. It's time to unite. It's time to understand that while we have a necessary investment in the defense, but I think it's extremely important that we need to invest much, much more in health. A good, strong, resilient, healthy Indian is worth millions. And I think that's what our motto is and should be. Uh, as far as ongoing is concerned, it's important that we also invest in a national level R&D center, which can act as a reference center. It can act as a global alert center for the next epidemic and pandemic, because these pandemics, and indeed in this pandemic, the second wave may come at some point of time. In the end, I would like to mention that egos are going to be archived. Politics will change forever henceforth. All irrelevant religious overtones are passe now. They've been fossiled. Countries which have not contributed towards the overall global growth will become henceforth irrelevant. Indian healthcare also will undergo radical transformations. I think the full concept of hand hygiene, hand washing will take prime focus. Social distancing will take prime focus. The time and tide now has changed. And I think it's time that the next wave of the superheroes in our society are going to be doctors and nurses, back office staff and technicians. And I don't think every superhero needs to wear a cape. I think the real heroes wear a simple white coat and a stethoscope. And I think India is poised for great growth in the post-COVID era. My prayers are that every human being in India be saved. We keep the mortality and morbidity to the least. I think it's important that all of us contribute as a nation. It's not individual first. We have to keep India first. And I'm sure in the post-COVID era, we will all arise and shine. Thank you everyone for your kind attention. God bless India.